So all patients have the same new patient experience. From there, I move into assigning you to one of 3 tiers. The tiers are assigned based on level of complexity of the symptoms that you're presenting with, the history you've told me about. Potentially there are, other records for me to review. There's varying levels of kind of testing that might need to happen to further determine more about the condition that you're coming with. And some conditions also require a fair amount of research depending on any number of factors. So tier 1 is for the lower complexity patients. That is for people who might have a singular issue that they're working on. They're otherwise healthy. There's nothing much going on, or maybe they're just using this as a tool for prevention. Tier 2 is sort of the most common kind of patient for functional medicine SF. These are patients who are generally functioning, but maybe have been ill for some time. Oftentimes they have an environmentally acquired illness. Their immune systems are dysregulated. There's sometimes chronic fatigue. But they're likely still going to work and able to manage their life pretty well. They still do sometimes come with other records from other physicians that I use as part of the case review, and generally speaking, that's the most common kind of patient that we see is a tier 2. Tier 3 is our highest complexity type patient. And tier 3 are oftentimes medical mysteries, patients who may have already been to even some of the top academic centers in the world with very few answers. They might have multiple layers to their illness, with one aspect of it having created or contributed to the next, and so on and so forth. They may be a little harder to diagnose initially, or they might have features of symptoms that require me to dig a bit more, or they might have life circumstances that are harder to create a plan around. Sometimes these are patients that might be so sick that they are having to stop other things in their life. They maybe aren't working at the moment. They might have pulled out of other areas of the life in order to focus solely on their health, and generally just need more input and more time to come up with the best plan so that you can start on a path that's ultimately going to get you fully well.